Hello, and how are you? Welcome to my session on Principles of Palliative Care. My name is Winnie Barawa. If you're new in this session, this is a channel that focuses on lectures, sessions, and expert interviews relating to healthcare. If this is your area of interest, kindly remember to subscribe, click on the notification button, and you can also comment to input on what is your feeling regarding this class. So, in this session, I'm going to focus on 6 principles that guide palliative care, or rather, what makes palliative care to be effective. So, let's go in and see the first principle. So, principle number 1 looks into the caring attitude and considerate mindset. So, this principle, what it does is it encourages caregivers or the palliative care team to show compassion, be empathic, and be sensitive towards the individual and care for their suffering in all aspects and not just in the aspect of health issues only. So the fact that a person is different and has unique needs is very crucial because it means as you look at the person, you need to ensure that your mindset is compassionate enough to ensure that you have a good care plan that meets the needs of this individual. So caring attitude or a considering mindset, this principle is to just guide us to put ourselves in the shoe of the other person and imagine how you would like to have been managed or treated if you are in the similar shoe. So show compassion, be empathic, be sensitive so that as you give this individual care for this patient, you incorporate all the aspect of this patient, spiritual, social, psychological, all this, and not just the physical needs of the patient. Second principle, main focus is relief from pain. So this principle encourages us that it provides that there is need for relief for pain and any other distressing symptoms. And according to this principle, it affirms that palliative care affirms life and treats dying as a normal process. Therefore, the main target is not to hasten nor to postpone death. And because pain is multifaceted, there's no single way to treat it. There's no single drug that will eliminate pain. However, there are different approaches that we can use to eliminate pain. And these approaches could be multidimensional. It could be through physical interventions, mental, social, all sorts that you can put in place to ensure the patient is free from pain. For example, the psychological management of pain, e.g., by encouraging the patient to look into stories, read materials, or tell stories so that they can divert their mind. But there's also pharmacological management of this pain, where you see, according to the WHO recommendation, there's the ladder, the clock, and also the strength, whereby you're able to give medication based on the pain level that the patient has. And the third principle appreciates care excellence. And by care excellence, we are looking at providing excellent services, be it nursing services, medical services, or auxiliary services, ensuring that the palliative care service team is top-notch, well-trained, and skilled. And this is supposed to ensure that people can access healthcare services or palliative care services that are appropriate and available enough for everyone without discrimination or favorism. So with this in mind, the principle of care excellence is that it allows the team or the professional team made of both nurses and doctors to deliver constant health care that has less of medical situations. So the main agenda of ensuring that there is in proper care excellence or there is proper skilled care for the patient is to reduce stress for both the patient and the family and to also ensure there is an expected situation of this patient. Because if you give proper care for our patient, we expect less complications, we expect less negative outcomes, and we expect good outcomes from our clients who can actually get well and become independent enough and do their own activities of daily living. So that's the purpose of the care excellence, ensuring that the service is top notch, easily available, it is appropriate, less with complications, and has good progress so that the patient can heal or the patient can pick up and become independent enough to work on their own. The fourth principle is on communication. So what communication principle does is that it ensures that all aspects of palliative management are well discussed with the patient and their family. That it is essential you have open communication or effective communication between the healthcare providers, the patient, and their family. So we are being told that communication is key between the various professionals involved in the patient care, patients, and their family. And so we are advised to ensure open communication methods of interaction to ensure that even the individual can communicate their wishes for their end of life that can be communicated to their patient, to their family, sorry, and this can be fulfilled when the time is right. So communication or effective communication is targeting open communication, ensuring there's proper channels of exchange of information between the healthcare team, the patient, and also the family. And the family and the patient mainly is on the point whereby patient would like maybe to pass their preferences to their families before they die, or provide a will, or provide what is the plan after death, and so on. Now, when communication is effective enough, then this or such information that can be availed on time. So what are the key components of effective communication skills? There's proper listening skills, there's response, there's use of body language, and there's also emotional awareness. When you incorporate this, then there's proper exchange of information between the required parties, and so everybody is able to understand each other, and together they can have a coherence on how information passes from one party to the next. Fifth principle is about family and patient support. And we are told that the success or failure of palliative care at home or hospital depends on the support and care that the relatives or the team provides. So families are advised to actually prepare for death, that it is inevitable and it might happen, and they should know what to do or what to expect. So it is important that the family are part of the support system for the patient. But again, they should also be provided with enough support from the skilled healthcare workers or from the skilled nursing workers, because they are the ones who spend majority of the time with the patient. So patient and family support is very important as a principle when it comes to palliative care, because with the support, there is development of hope, patient become more positive, the perspective is different, and sometimes the response to treatment also becomes different, and most of the time it gears to the positive side. So support is very important, not only for the progress of the patient but also for the preparation of the family in case death occurs. And the last bit is on the 4 ethical principles that can be incorporated as principles for palliative care, and that is autonomy, beneficence, non-maleficence, and justice. So the principle of autonomy says or dictates that there is need to respect for the individuals and their ability to make decisions in regards to their health and also their future. So in respect to the care that we provide to our palliative patients, we are told we need to respect the fact that even when we know the outcome might be negative, we need to respect the patient decision in regards to their own health and their future. And the other principle is on the principle of beneficence, where we are saying we need to focus more or put more energy on doing good and promoting good, while at the same time preventing and removing evil or harm. So here we look at the benefits, or put all our efforts together for the benefit of the patient. And the other principle is on non-maleficence, which simply means do no harm or avoid harming the patient. Rather, let's not implement management that can harm our patients. And last part is justice, or principle of justice, which believes in maximizing benefits to the patient, the society, while emphasizing on equality, fairness, and impartiality. That we ensure that the patient is justly treated, respected, and ensuring that their rights are intact and well observed. So those are the few ethics and principles that are quite key when you're managing palliative care, when you're implementing palliative care. So it caters all the way from care excellence, communication, looking at the aspect of ethical principles with autonomy, beneficence, non-maleficence, and justice. And all these aspects that come together to ensure that the patient gets optimal and quality palliative care. So these are the guiding principles for those who have a consideration of working in a palliative care area. So thank you again for staying with me to the end. Remember to subscribe, comment, share, and also like this video. Until we meet again, bye bye.